Good evening. My name is Jada Williams. Today we will be discussing subsidizing birth control in America. In this presentation, I want to take a look at the pros and the cons of how the government can change the opinion of a woman in birth control and if it will be able to be in use in the near future. First, we're going to talk about our pros. One pro I think is very important to consider is public health. With birth control being subsidized in America, this can lead to a reduced amount of unintended pregnancies, decrease the amount of abortions, and overall help the maternal health of a woman and low child income. Other pros to consider is women of color, Hispanics, and more find it hard to find affordable birth control options through their health care or insurance. Another thing to consider is pregnancy deficiencies that can happen afterwards, before birth control and after. Another thing to consider is birth control can affect a woman's body before and after use. By providing access to public health in America, unintended pregnancy can significantly decrease in numbers. According to Pharma News Intelligence, there was data gathered in 2011 based on the CDC that more than 45% of pregnancies in America are unintended. Another pro to consider is prevention of sexually transmitted infections. With this, most of the time this is by condoms. Condoms have very greatly decreased the amount of the pandemic of AIDS and curable STIs such as chlamydia, gonorrhea, syphilis, and triad. According to the World Health Organization, condoms have had a huge impact of AIDS. 374 million people have STI infections that are occurred globally that are curable. With better control over the timing and spacing of pregnancies, women can avoid health risks associated with pregnancies that are too closely spaced for that occur in older age. Unintended pregnancy can also have mental health consequences, such as increased stress or depression. Access to contraception allows women to access and have control over their reproductive lives, which can lead to better mental health outcomes. Another pro I want to get into is social and economic impact. Doing this, how does it affect our society? When women have control over their reproductive choices, they have greater opportunities to pursue education and employment, which can lead to a broader social and economic benefits for the community as a whole. When the government subsidizes contraception, it becomes more accessible to a larger segment of the population, including poor or uninsured women who may not otherwise be able to afford effective contraceptives like birth control pills, IUDs, Norplant, Depo-Provera. This increase has several public benefit healths. Now we're going to get into our cons. Moral and ethical concerns. Some may argue that government involvement in birth control can raise moral and ethical concerns, particularly among those who oppose birth control for religious or personal reasons. Another thing to consider is cost to taxpayers. There is a cost to taxpayers as government subsidies are funded by public money. According to Planned Parenthood Action Fund, more than a third of female voters have struggled to afford prescription birth controls at some point in their lives, and as a result, use birth control inconsistently. The last thing that is the biggest issue is government overreach. Some believe that subsidizing birth control is an overreach of government power and that health matters should remain private and at the woman's choice. In the last part of this segment, I would like to discuss my personal stance and why or why not I believe the government should subsidize birth control in America. I believe that government overreach is very true. I feel if the government overreaches and take away the power of birth control and choosing a woman's choice will have an overall society impact, good or bad. There are women who struggle with rape, there are women who struggle with problems in their body, and birth control will help decrease all of those things. Personally, I do agree that healthcare is an issue and there isn't a lot of affordable birth control options. Therefore, I feel the government should come together to find affordable options for women of color, Hispanics, or people who are not insured or can afford the medicine. Thank you.